there's been some very interesting articles have come out in the last couple months looking at two diseases. One is diabetes type 1 and the other is Parkinson's disease. And we're going to start with diabetes type 1. What they're trying to do at the big institutions is be able to get the pancreatic tissue to regrow the islet cells, which are the cells that produce insulin. And they may be taking embryonic tissue, which ethically I have a problem with, but they take that tissue and they grow those cells out and find the ones that produce islet cells, and then surgically they put them into the pancreas of the type 1 diabetic. And it's starting to show some really interesting results that the pancreas often starts to make insulin again, which is the big problem in diabetes type 1. Now, in some of the trials, the patient has to be on immune rejection drugs. Others, there's been one short trial of one person where they didn't have to use those type of drugs. But it is very promising. Ethically, I have a problem with using embryonic tissue. And right now in the US, embryonic tissue, last thing I heard, was illegal to use, at least general public wise. So what we did is we took a type 1 diabetic patient on insulin, and we said, all right, we're not going to use embryonic stem cells. We're going to use cord blood stem cells, and they haven't differentiated into any type of cell yet. They can become any type of cell once they're in the body. So what we did is we took those stem cells from the cord blood, we injected it a certain way into the patient, and we watched what happened. And basically this, C-peptide is the test you order to see if the body is making insulin. So before the procedure, the C-peptide was 0, making no insulin. We gave the stem cells, and the C-peptide went up to 2.5. Normal range is 0.8 to about 4.5. So the person is making insulin, but here's the great thing. The patient's been off insulin for about a year, producing its own insulin. We did not have to surgically do anything to get stem cells in the pancreas, whatever. But the interesting thing about umbilical cord stem cells, they look for damage and they go up and repair. And without getting to really expensive ways of doing things, it really was a very cost-effective way of getting a patient to start to repair their body so they can get rid of, you might say, type 1 diabetes. Now, this was just a 2-patient study. The other patient is also doing well, but we're going to be doing more research on this. But we were able to do it for a very minimal amount. Versus in these other big trials, you're spending a lot of money, and a lot of people aren't going to be able to afford the price to do that. So just looking at very basic biochemistry and how the stem cells work, in our little 2-patient study, it's been very encouraging that, hey, maybe there is a cheaper way of getting the pancreas to repair itself.